Hello class, in this video I'm going to be talking about Benjamin Freedman's argument defending clinical research trials involving human test subjects. I think the best way to understand his argument is as a response to Hellman and Hellman's objection to clinical research trials involving human test subjects. So the way I'm going to structure this video is by giving a brief recap of Hellman and Hellman's objection to these human research trials, and then I'll show how Freedman responds to this objection. Okay, so remember, Hellman and Hellman thought that human research trials were morally problematic because they generated a sort of ethical dilemma for the researchers who took part in the trial. And this ethical dilemma arose when at a certain point in the trial, the researchers noticed that some patients were doing worse than other patients. And at this point, the researchers had an obligation as medical professionals to remove the patients from the trial. And the reason is because it appeared that since they were doing worse than the other patients, they had an obligation of beneficence to do what's best for the patient to remove them from the trial. However, in removing them from the trial, they are violating their obligation as researchers to maintain the integrity of the trial. By removing these patients from the trial, they're jeopardizing the results. Okay, so there's a sort of ethical dilemma that researchers face at some point in just about any research trial involving human subjects. And because of this, Hellman and Hellman thought that these trials were unjustified and should be abandoned. Okay, Freedman thinks that there really isn't an ethical dilemma here. Even though it appears to the researchers that some patients are doing worse than other patients, this doesn't constitute genuine medical knowledge. Freedman argues that genuine medical knowledge isn't at the level of the judgment of particular doctors or particular medical professionals. Genuine medical knowledge is at the level of the greater medical community. So just because one doctor or two doctors or three doctors have a hunch, or it appears to them that some patients are doing worse than others in a particular trial, this doesn't give them actual medical knowledge to say that, yes, we should remove these patients. It's our obligation to remove these patients from the trial because we know that they're doing worse than these other patients over here. Freedman says they don't really know this. The only way that they could know this is at the greater community level. In fact, the only reason why we're doing these trials in the first place is to receive greater medical knowledge at the community level. So how is this a response? Let's back up. How is this a response to Hellman and Hellman's objection? Well, Hellman and Hellman thought that by keeping patients in the trial that appeared to be doing worse than others is a violation of beneficence. And Freedman says, no, it's not a violation of beneficence to keep them in the trial. And the reason is because we don't really know that it's hurting these patients to keep them in the trial. We may have a hunch, it may appear to us, but we don't really know. The only way that we're going to know which drugs are harming patients more than other drugs, which drugs are helping patients more than other drugs, is by continuing these trials, doing more and more and more trials, gaining further and further medical knowledge. That's the way that we'll know which treatments are more effective than others. So Freedman concludes that contrary to what Hellman and Hellman thought, there really is no ethical dilemma in these research trials. Okay, that's all I have for today.